Thank you so much for the opportunity to speak today. I had said that I would be coming and speaking about actions we're taking with respect to nicotine pouches, and I'm pleased to be able to speak with some additional details on the action that our government is going to be taking. Let me say in the first order that when it comes to cessation, we want to see innovation. We want to see products that are going to get people off of nicotine and off of tobacco. We know that smoking remains the #1 cause of preventable death in this country. It's responsible for untold loss of life and for untold illness. And so when it comes to innovating in the space of cessation, I celebrate that and want to see more of it. But that isn't what happened. The tobacco industry, yet again, used a loophole to try to create innovation in the space of cessation to get people off of these products, to create a brand new line of products that addicts particularly kids to products that are deadly for their health. I was with Heart and Stroke when we dealt with the issue of vaping. And there were many voices at that time when information was uncertain who said, let this exist as a cessation tool. Don't take action. The result of that, unfortunately, was that the tobacco industry was able to addict a whole new cohort of young people who had no exposure to nicotine to something that's absolutely deadly for their health. It has had very injurious outcomes for our health system. We cannot allow that to happen again. And I would say to the tobacco companies that continue to look for ways to use loopholes to addict people to their products, get away. Stay the hell away from our kids. And so there's a few things that we're going to be doing. I have written the provinces and territories to work specifically with them. In the first order to say that when it comes to products, I'm seeking authority to restrict products so that they are solely for the purposes of cessation. We shouldn't be seeing flavors that are targeting kids. Flavors like, you know, winter berry splash or whatever, tropical fruit, whatever that they're putting out there. We all see through it. We know what the intention is, and it's over. It's essential, and I'm seeking these authorities immediately in the conversations I'm having with provinces and territories for all cessation products, that the only flavors that should exist should be for the purposes of promoting cessation. In the second order, when it comes to marketing, I'm seeking authority to make sure that before any marketing goes out the door, that marketing comports with the approved intent of the product. It is reprehensible to me that the tobacco industry, after being approved for a cessation product, will be putting out ads and information to try to addict kids to these products. And let me be really clear about the size of this problem. I am talking to oral health professionals as we're rolling out a national dental care program. And what do I hear in those conversations? But that young people, under their tongue when they're playing hockey or baseball or sports, have these products, and they're destroying their oral health. They're putting them at risk of cancer and all kinds of illness. And these are kids who have no exposure to tobacco or nicotine before. That's entirely unacceptable. The fact that they would be engaging in marketing in that way is terrible, and it ends. These are the powers that I'm going to be seeking. In the last order, because the tobacco industries have been successful in addicting a whole new cohort of young people to these products, to me, it is absolutely essential that we see these products move behind counter. I want to thank British Columbia and Quebec, who've been leaders in this area. I've had positive conversations with my other provincial and territorial health minister colleagues. We're going to be sending a letter out, but hopefully you can hear in my voice and my intention. I don't ever want to go through this again. What we saw happening in vaping, all the illness, the death, the sickness, we cannot allow that to happen in nicotine pouches. We cannot allow this to happen in an abuse of a channel, a legitimate channel in cessation that's been opened. And these measures, working with my provincial and territorial counterparts, I'm convinced will do the work. Et je peux dire en français rapidement la même chose, que la situation actuelle, c'est pas acceptable, pas du tout. Arrête. Pour toutes les personnes qui sont responsables pour les nouveaux dépendances, particulièrement pour les enfants et la jeunesse, ce n'est pas acceptable, pas du tout, de créer des nouveaux dépendances. C'était le cas avec le vaping, et encore c'est le cas avec le sachet de nicotine. Et pour moi, il faut qu'on prenne d'action. Et ça, c'est les raisons pour lesquelles, pour moi, je vais chercher pour le pouvoir d'arrêter le saveur pour les produits de tabac et aussi de s'assurer que les publicités pour les compagnies de tabac sont limitées seulement pour éliminer les dépendances de tabac. Et dernièrement, comme l'action de Québec et la Colombie-Britannique, de s'assurer que des sachets de nicotine sont seulement disponibles à l'autre côté du comptoir. Et je peux prendre vos questions maintenant.
I just want to be clear about what you're asking to do with your provincial counterparts. And OBC's put these behind counters. Is that what you want to see happen in this case? And would you consider doing the same for things like other smoking cessation things like nicotine gum and that sort of stuff?
Well, I think, look, there are some things that are working very effectively in the space of cessation, and there are many in the industry who've been very responsible with those products. And we're not seeing, youth being addicted to those products because they're very appropriately targeted at people who are trying to break what is a horrible, horrible addiction. So, in those instances, I think we have to observe how the market behaves. And say that we want people to have easy and unfettered access to legitimate cessation channels. And that's why we've got to have conversations with our provincial and territorial counterparts. My objection in this instance is that the marketing that was done by the tobacco industry around these tobacco pouches had nothing to do with cessation. It had everything to do with trying to create a lifestyle and an attraction to a new product that's going to addict people who have no exposure to nicotine or tobacco as another delivery mechanism to that product, which is an agent of death. And let me be very blunt about it. Our objective, and prohibition doesn't work, we know that, but we need to help people get off of this thing. It's awful, and to open up new channels to addict new people is not acceptable. And so where they use marketing and flavors to create, to contort the openness that we have, trying to create innovation for people who are stuck having these very terrible dependencies, to use that opening to pervert it, to try to go after our children, like stay the hell away. And I've had enough of it, and I'm sick of it. I dealt with it when I was at Heart and Stroke. I'm dealing with it again as Health Minister. We can't have this continue to happen.
So is the goal to get rid of the flavors or to put them away and out of reach of kids? Like what's the...
Yeah, let me be, and I'm talking in broad terms because I sent a letter to my provincial and territorial counterparts just yesterday, and we're having these conversations. Some of them are powers that are going to rest and we're seeking for me to have as a federal health minister. So as federal health minister, I want the ability to be able to restrict flavors only to those that are exactly logical to the purposes of cessation. I want to get rid of flavors that attract kids or are trying to be lifestyle marketing. And then in the second order, I want the power as minister to be able to say, and I'm going to seek it, and I believe I will achieve it, to say that, your marketing, you got to show us before you put it out the door. And that your marketing has to comport with the reason you were approved. This isn't a chance to use an approval to pervert it to create a whole new laneway. We need to see that marketing is actually for the purposes of cessation. And then in the third order, because these problems with pouches are really very serious, and we're seeing a whole new cohort of young people being addicted to these products, in my estimation, these need to be moved behind the counter because they represent a clear and present threat to our public health.
Wait, sorry, I was just going to say on this topic before we move on, talking about vaping, for example, and people have used vaping to quit smoking. So one of the reasons they like flavors is because it's pleasant, and
Sure.
that helped them to quit. I mean, that's the exact thing that attracts kids to it, and I imagine it's the same in this case. So what do you say to those smokers who feel like, they don't want it to be yucky, they want it to be a pleasant experience?
Sure.
That they...
Well, and that's why I say we're going to have that conversation about restricting it to what is absolutely necessary for the purposes of cessation. Now, and I'm not going to enumerate what those flavors are, but if you're talking about tropical berry splash or whatever kind of nonsense they're putting out there, like go and look at some of the flavors they have there. They clearly are aimed at children. Like I don't know of an adult who is looking for winterberry splash. Like this is targeting kids, it's targeting flavors that are going to make it easier to kids to get addicted, and it's not about cessation, right? If it's about cessation, then let's make it specifically something that makes sense for cessation that isn't going to attract a new cohort of people to that product. And the fact that their marketing was about lifestyle and about, cool sensations and feelings, and it was all around lifestyle, is just further evidence that their intention had nothing to do with cessation. And the proof, if you want to see it, is all the young people with no exposure to nicotine or tobacco who are now getting addicted to these products.
Just ask a couple questions here. So these are powers that provinces have, and you're asking for them.
No. So to be clear, I'm going to be seeking a couple of powers. I'm going to be seeking the power to be able to restrict flavors down to what's only essential for the purposes of cessation. Exactly what those flavors are, that's going to be a conversation with the provinces, but it's going to be very restrictive because it has to be purely for the purposes of cessation.
They would have to do this.
No, it would be something that we would enact federally in order to restrict the flavors, but I want to do it in consultation with the provinces and so that we're aligned. Yeah.
Would you do this through regulations? Like, how are you going to do
Yeah,
this?
I mean, we would have to do it through regulation, as well as the piece that I spoke about marketing, which would be a power that would be rested with the Minister of Health.
How soon would this come into force?
I'm looking to do this imminently, as soon as is possible. But I mean, there has to be a process. That's what
It's been happening since November.
No, I understand that, but I sent a letter yesterday to provinces and territories. I've been having ongoing conversations with them. I'm seeking the authority. I'm no longer the House Leader, so I don't control the House agenda, but I'm seeking these authorities in the quickest order possible. But I wanted to say that this is really in the very immediate term we want to be acting on these things. I understand that every day that we wait is a new day the tobacco industry can addict people who are not already addicted to these products, and that they are being used entirely inappropriately outside of the scope of what their approved use was.
Avez-vous les pouvoirs actuellement ou vous demandez l'autorité aux provinces de vous accorder ce pouvoir-là?
Non, j'ai besoin l'autorité, et cette autorité-là peut venir pour un processus parlementaire fédéral. Et ça n'existe pas aujourd'hui. Je n'ai pas le pouvoir d'agir maintenant. J'ai besoin des pouvoirs additionnels de prendre l'action que j'ai expliquée.
Qui vous les donne, ces pouvoirs-là? C'est qui?
Parlement.
Le Parlement.
Le Parlement de Canada. Oui.
Word. What do you make of word that the scientists fired from the Winnipeg lab have resurfaced in China and are using pseudonyms?
Well, look, as I said, I'm deeply disturbed that two Canadian citizens who were eminent scientists lied to the Public Health Agency and acted in a way that is deeply disturbing. They're under an investigation, and rightfully so. That investigation is ongoing. It would be inappropriate for me to comment on the nature of that investigation, but I would say that it's extremely appropriate that the investigation's occurring and that their behavior, as you're outlining and as in other examples, is very worrying.
How do you know that what you're doing today with the nicotine pouches, won't result in some sort of legal action?
Whatever dark corner the tobacco industry crawls and creeps into to go after our children, wherever they go, wherever they think, whatever loophole they think they can find, they will meet me like an iron wall. And so I'm saying through you to the tobacco company, if you do not hear in my voice the concrete nature of the action we will take to meet you, to stop you from going after our children, then you do not understand my determination. I am sick of it. I am absolutely sick of it. Watching and talking to parents dealing with sick children who've been addicted to these products, who've had their reward systems hijacked because they've got companies using their billions of dollars to addict them, it's done. And if you can find some new loophole, you're going to find me there waiting for you.
Capable de dire ça en français? Ah, non, mais sérieux.
Oui, non, c'est pour l'industrie de tabac. Je vais dire clairement que dans chaque instance, dans chaque occasion, quand vous avez essayé de créer une nouvelle occasion, de créer les dépendances, je vais être là, de dire non. C'est pas acceptable, pas du tout. En droit protège notre enfant et jeunesse, et c'est pas acceptable qu'une industrie faire des actions comme ça. Not the same thing, but there you go. Thanks so much.
Merci pour l'effort.
That was the best.